Sidney Weber Salas, and today we're going to talk about finding the right desk. The most important factor is going to be your height, since almost every desk is going to be fixed on an ergonomic basic design, which means it's fixed for an average person. Especially if you are taller or shorter than an average person, then you need to do some adjustments. Remember that it's very important to find the right seat for you first and then adjust the desk. If you have any questions or any doubts about how to do so, you can go to our last video and check it out. Remember, when sitting down, your feet should be sitting flat on the ground and your knees should be a little lower than your hips. And also you can use a footrest in case your feet are dangling from your chair. The key to finding your ideal desk is ensuring you can comfortably maintain a 70 to 135 degree angle with your forearm and upper arm. As you can see, this table is too high for me. If you keep this high position for long, you will feel it on your upper back. The ideal for me, as you can see, will be below this table. Since I've been receiving lots of questions and it's a very common word to hear, let's talk a little bit about torticollis. Is a condition in which the sternocleidomastoid muscle causes an abnormal rotation, inclination, and flexion of the head. If you do with your head an ipsilateral inclination, then rotate to the other side and flex your head, you're gonna notice your sternocleidomastoid muscle, and sometimes in some cases it can get even some other muscles can be affected as well, depending on the severity of the condition and the condition of the person, of course. But let's talk about the type. First, congenital. This can happen during gestation or birth. Occurs a trauma which causes edema to the muscle, and then it develops fibrosis and a couple of other complications involved in this. Second, dermatogenic. It's caused by a burn or a scar in the skin that causes a retraction on the muscles involved in that area. Third is going to be neurogenic. It's related to a neurological illness. Then we have vestibular. It's related to the ear. It can be an infection, it can be any illness. Ocular, that it's related to the eye. And we have other that is rheumatoid, and it's in which it's related to another rheumatic infection or illness or condition that a person can be suffering. And lastly, the most common one, spasmodic. It can be caused by stress, by physical overload, or simply because you did a sudden move and it increases the muscle tone. Treatments for spasmodic torticollis are ice pack, massage therapy, physical therapy, and if it comes to that point, you can go to your doctor for some painkillers or anti-inflammation pills, or in some cases where we're talking about congenital torticollis, the treatment would be surgery. The one I would like the most to prevent and to treat is stretches. So remember, you can contact me, you can tell me any questions or suggestions that you have, and I hope this video was useful for you. See you in the next one. Ciao, ciao.